Good morning, Chicago. It is Tuesday, August 4th. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Thanks so much for joining us on our Facebook Live. We are taking questions live. We've also taken questions that people have been putting in since the last time that we met. You can either put them in the box below, or you can put them on Facebook or Twitter with the hashtag AskDrArwady, and we'll be taking questions. So we have a special guest here today. This is Rosa Escareno. She's the Commissioner at the City of Chicago's Department of Business Affairs and Consumer Protection. And you might not know what that is. BACP is the acronym for that, but they've been an amazing partner to us in terms of the COVID response here in Chicago. So I'm going to let Rosa tell a little bit about some of the work that BACP has been doing, and I know it's in line with a lot of questions that folks have been having. So let's check our social distancing first.
Yes, here
so
we
look good. This is again a really easy way for you to check. If you can do this all around, you're keeping your 6-foot distance, obviously with the masks in place too when you're out and about. So let's start off with just a little bit about you and BACP.
Sure.
Thanks so much for being on.
No, thank you. Thank you so much. I think this is incredibly important. First of all, thank you and all of your team for the leadership that you guys have provided during this unprecedented time. Well, I'm the Commissioner of the Department of Business Affairs and Consumer Protection, and we are the city licensing and regulating arm of businesses, but we also are the consumer advocate as well as the Office of Labor Standards. So under COVID, it's been incredibly important for us to work together because during COVID there have been so many guidelines and so many instructions, not just for the general public, but for our business community. We have hundreds of thousands of businesses here in Chicago, and we license 60,000 of them.
Wow.
And so through your leadership again, and the guidance that has come through your office, and not only the guidelines, but there's been very specific executive orders that have been issued through your office that our business community must follow and have been following. But I'm extremely proud of my team as well. We've been doing a lot to certainly support businesses. And so the mayor, when the pandemic hit very early on, the mayor has put out different loan programs and grant programs, over $100 million in grants and loans for businesses. And so my department has been administering that. Everything from the Resiliency Fund, the Recovery Grant, and the Together Now Fund, which we recently just announced. But also we have dedicated our time to ensuring that the businesses understand the guidelines.
Yeah.
So
that's been a lot of change for everybody.
And
so
Dr. Arwady, I have to tell you, I love you, but it changes every time. And our businesses we give them the guidelines. We train on this all the time. And when something new comes up, you know what? We do it again. And they have been extremely incredible. They've been doing such a great job. So we have been making sure we're training on the guidelines, and that we are also regulating, which is extremely important. So not only are the guidelines, but now our people, are the businesses and the employees doing everything that they are required to do based on these important guidelines. So, you know, once those guidelines come out, we've held over 100 workshops and have seen over 13,000 attendees through these workshops.
Wow.
So you keep it coming, you keep pushing it out. And so
we've been busy.
Yes, we keep, you keep us on our toes. But very important to the reopening. In early June, when we started to reopen, and all these guidelines started were provided, we then had to put our people on the ground to ensure that the compliance and that the enforcement piece has been.
That's some of the hardest work that we do as a city, I think. And your team's really right out in front there.
It is, and you know, I will tell you, our business community has been extremely patient with us because we are saying, we want you to stay open, but you have to follow these very specific guidelines. And so our enforcement team has been doing a really good job of going out there, making sure that the social distancing, the face mask wearing, the number of people that are allowed or not allowed to be in. So when we opened up, and then when we rolled back, we had to go back and say, okay, now you have to tighten up. And so we work literally at the hip with your team on all these issues. And so we're also putting together programs as part of that reopening. Where we're closing down businesses, your guidance, your leadership has been so important in saying outdoors is always much more safer than indoors. And so we've established an incredible program for expanded outdoor dining. But we also have to make sure that even when we open that up, that we're still on them about the social distancing.
Right.
But I have some great news, Dr. Arwady.
Okay.
The grand majority of our business community is doing an exceptional job of following the guidelines. And, sad to say, many businesses have not opened, some have had to close, but many are staying in it and are doing the right thing. They're being really responsible. So again, an incredible challenge. We literally look for your guidance every single day. And so to the business community and to your followers, it is so important to support our businesses, but it's even more important to make sure that we're doing it with all the guidance that you put out every single day.
Yeah. Absolutely. Perfect. So I know you're going to have questions on all of that. So if you've got questions related to businesses in general in Chicago, the grants and the loans program, the ways that we've been supporting businesses, the ways that we've been enforcing, the way that we've been educating, the way that we've been sort of working together as guidance has shifted, here's your woman to help answer your questions. So let's take a minute and do a data update, and then we'll come back and have a little more conversations about the details of some of that, and then start getting into some questions. So as always, you can get to our data dashboard in two ways. If you go to the main COVID website, which is chicago.gov/coronavirus, right up at the top, there's that latest data tab, and that's where you can get the dashboard, you can get the hospital data, you can get maps, all kinds of things. You can also get there directly on chai.gov/COVID-, and that is now mobile enabled, so you can look it up on your phone. We continue to make improvements. So let's go to the computer here, and this is now the front page that you will see on chai.gov/COVID-, and it looks a little different than what we've had previously, and partly that's because we've updated the positivity rate, and specifically to include the test positivity rate. So those of you who have been following along know that we've been having conversations that there's two different ways that you can measure percent positivity. Either you can measure the percent of the tests that are done that are positive, or you can measure the percent of the people who are tested that are positive. And the difference between those is that sometimes one person might have a lot of tests if they work in a high risk setting, for example, or they've had a nose test and a mouth test, or they've had multiple exposures. And so depending which of those positivity rates you report, it's not that one is better or worse, they're used for different things. The state uses the test positivity rate. And so that's the one we've now moved to, putting on the top of the page here. So our current positivity rate is at 4.8%. And that is consistent with the way that the state measures. That's our number of positive tests divided by the total number of tests that are done. Now, over here, back on our daily by demographic, this is where the other way that we calculate it, this people positive number comes in. And you can see that's at 6.1%. That's what we'll use more to make decisions about where to push testing resources, or to understand how different race ethnicity groups or different zip codes, what that testing is looking like. Because if you think about this, you don't want to skew the numbers in a given zip code or in a given race, ethnicity, or even age by somebody who's getting tested over and over and over again. It can make you look like you're getting much more testing than you are. And so we've really stuck to that people positive in terms of where we're pushing resources, but the test positivity rate is the one that's being used across the whole state, and so that's the one that we'll be primarily referring to. So we're at 4.8% this week, up from 4.2% a week ago, not heading the way we'd like it to see. We want it under 5%, which is there but close, but we'd really like to see that come back down. The lowest that we saw this rate was under 4%, 3.8, 3.9. We've also included then here our cumulative tests and then our daily test average. We've done more than 628,000 tests here in Chicago, and we're averaging just under 7,000 tests a day right now in Chicago. Again, that's a little different than the daily is the number of people tested. So you can look at this both ways as you're interested, but this is consistent with state reporting. And then finally, this bottom number at the top, those of you who have been, the daily case average, those of you you who have been following along know that this is the number we're the most interested in. And you can see we've had a total of 61,889 cases, and our 7-day rolling average is up to 273 cases per day. Just a week ago, we were at 261. And that is not the direction that we want to be moving. I'll come back over here. You can see on the daily, here's what our graph is looking like. And just to kind of help you understand this case rate, we're at about 270 cases per day. One of the ways that we compare how outbreaks look in different places is by correcting that for population, right? A place that has a very large population, you would expect to have more cases. A place that has a very small population, a relatively few number of cases could actually signal a very bad outbreak. And so if we have about 270 cases per day, and we have about 2.7 million people in Chicago, that means that we're at an average of adding 10 cases per day per 100,000 population. Okay, that's how that works out. And that's important because that's how we'll often compare across different states or different jurisdictions. And so, for example, the city has now just hit that 10 cutoff. That's the same calculation we do for our travel order. And so let's just look quickly. The last data point I want to show is because it's Tuesday, we updated our travel order today. Let me just go to full screen here. So what we can see here, I'll remind you that the travel order in Chicago, this is the requirement that if you travel to one of the states under the order and you return to Chicago or you come to visit Chicago, you have to quarantine for 14 days unless you're an essential worker. There's some other exemptions. And so all of the states in red on this map are our current states that are under the emergency travel order here in Chicago. And you remember last week, for example, we added Wisconsin. That was a big deal. All of the states in yellow here, which you'll see include Illinois, are somewhere between 10 and 15 cases per day per 100,000. So here in Chicago, we literally just hit that 10 mark, like in the last day or two. Many parts of the state, there's about 40 counties that are having worse outbreaks than we are in Chicago. And then all around us, the states are having more trouble than Illinois is. But we're seeing a lot of travel, and we're seeing a lot of cases here in Chicago from people who have traveled to high-risk settings. So this week, we didn't actually add any states. We added Puerto Rico as the only sort of state or jurisdiction that was over that 15 case per day per 100,000 population mark. But all of those states in yellow in the 10 to 15 mark. And so last thing I want to highlight is you see how there's 3 states here, Utah, Kansas, and Iowa, that are in this striped red and white. That means those are states that have been on our list, but they're turning their outbreak around. So they've gotten below that 15 case per day mark per 100,000 population for this week. To come off the list, you need to be in control for 2 weeks to try to avoid this up and down all the time. But assuming that those 3 states keep their outbreak in control, they will come off the list then next Tuesday. And so the whole point of this is once you're on the list, you're not there forever, but you're there while your outbreak is in poor control. And everywhere in red has an outbreak at least 50% as bad, worse than we are here in Chicago right now. So that's the update for today. As always, we do the update on Tuesday. It goes into effect the following Friday, and we'll see where we are next week. So, all right, I think that's enough for a data update.
Well, I'm a little, concerned.
Yeah, no, that's
I'm
right.
a little concerned.
We're concerned too.
Right, because in my world,
yeah,
we drill it into the businesses. You have to do the right thing because they're really fighting to stay open.
Right.
And so anytime we have to roll anything back, we point to those numbers, and I always say, please look at the data. Go to the Department of Health data, because if those numbers are increasing, then you probably have to start to think about what could potentially happen. So when I hear you providing the guidance right now and the latest update, it is concerning for us.
Absolutely, because that 270 number, right, that's the number we follow the most. we want that number under 200.
Right.
And we were under 200 a month ago.
Right.
And when we were when we were under 200, that's when we were looking ahead saying if we can get this down under 150, under 100, we'll be thinking about expanding. We've not been able to do that. We've been having to pull back and, we have to turn this around as a city. And I actually did a press conference just about an hour ago. So if you're interested in some, hearing some more about the data, you can take a look. But we really pointed to the fact that by and large, what is driving most of this are people spreading COVID in their household and in social gatherings.
Right.
And so as opposed to early on, we were seeing a lot of cases in long-term care facilities and in the jail and in shelters or even in large workplaces that didn't have a lot of the safety precautions in place. At this point, those settings are in pretty good control. And, a lot of the businesses you've been working with have been doing a great job in terms of really having precautions. And we've learned a lot about how to help protect against COVID. And where we're seeing problems now are more people getting together sort of outside of this.
Right. And that brings me to the latest initiative that we just rolled out. Last week, Dr. Arwady, when you were indicating to us that we were seeing these congregations, and we hold very close partnerships. We never work alone.
Yeah.
Great partnership with our Chicago Police Department, Fire and Buildings. But with the Chicago Police Department, they are indicating to us, yes, there's illegal gatherings all the time. And so we established an initiative because of your concern of gatherings. And so this past weekend, a partnership with the Department of Buildings, Fire and Police, we established a task force to monitor and identify 911 complaints, 311 complaints, and Eventbrite, for example, where we know that there are parties that are being organized and held.
Yep.
I can't believe in this day that there are still individuals that are not only promoting parties, but even residents. You need to stay safe. You should not be going to these parties. Right. But this weekend, we started our task force and we conducted enforcement on 23 locations where we found gatherings. Mm-hmm. We issued a total of 8 either orders to close or physical closures. Mm-hmm. So not only at warehouses, the businesses are actually not doing this anymore because we've been working with them. And so we're finding that individuals looking to still hold these events and bring people together are doing it at unlicensed locations, which brings the level of concern even greater. Yeah. Right? Because now if you're going to an unlicensed location like a commercial, like a warehouse, for example, if something happens at that warehouse, all the safety requirements aren't there. On top of which now we find people no masks, no social distancing, dancing, and all of this is what I believe is certainly increasing the numbers. So I think the biggest message, while we certainly work with the business community, is that if you know of a party or have seen a party where 30, 40, 50 people, and in cases hundreds of people are gathering, you need to call 911. Our goal is going to be to identify the event coordinators. And if it's in someone's home, unfortunately, I hate to say this, is that you can be subject to violations by the fire department, by the buildings department, and certainly by the police department. And the individuals can be subject to holding events that are required to be licensed. And so there could be violations to multiple individuals. This is a part of my work that I really don't like to talk about, but I think this is so important because it goes to the health and safety of our city. Right.
Right. And so, when people do let us know, sort of through 311, for example, or through 911, if there's a very acute issue, we want to take this seriously. We want to do something about it. We want to enforce about it. It's a big deal, and we've been seeing, spread in these settings, and nationally, we know they're a huge risk. So, we often get questions about enforcement, and actually, someone was wondering, what are you doing to sort of crack down on residential parties? So, it's all about what what legally can we do, and then what practically can we do, because this also takes resources.
Absolutely.
And the goal always, first and foremost, is to educate people. We've been educating people for a long time at this point. And as you say, folks who are hosting these big parties, I think fundamentally recognize that they're probably running some risks that just are not allowed and are not appropriate sort of here in Chicago.
And again, to the business community and education, I think we spent, since March, we've been working on the education. And so to the business community, at some point we said, time for education is over, now it's time for enforcement.
That's right.
Well, now we are seeing great compliance. And so now we're finding these gatherings at places that people should actually not be going because they're not safe to begin with.
Yep.
And there is an enforcement component with violations and citations. One of the things, Dr. Arworthy, under one of your executive orders, you gave my department the authority to enforce on violations to COVID regulations. And in case individuals don't know, if we cite you with one of these violations, the violation ranges between $2,000 and $10,000 per violation.
Yeah.
We have issued some of these to businesses, and now we can actually issue that across the board to other places that may be hosting large gatherings.
Yeah.
So just beware.
Yeah, and similarly, on the health department side, we have food protection. We have a whole team that does food protection, and they do restaurant inspections year round, really looking to help protect you from foodborne illness. And they also have been looking at, potential COVID violations. And initially, it was about, if you identify something, you educate the business. You sort of say, okay, here's what you need to change. I know this is new for everybody, but then when we're following up, if things are not corrected, or at this point where there has been, a lot of outreach from your department, outreach from our folks, sort of that time for warnings is kind of over at this point.
Right.
And we're not wanting to make life difficult for businesses, just to be really clear about that. And most are doing a very good job. We want to keep the businesses open. We want to keep our economy going. The last thing that we want to do is have to take those big steps backwards, like we've seen in so many other parts of the country.
Absolutely.
So that is a concern.
Yeah, and I think on this point, one of the important parts of what we're going to be doing with this task force is, if we identify these events in advance of the event actually happening, the goal is actually to make sure it actually does not happen. And so to prevent any problems, any violations. And again, to the general public, if you see these events or gatherings, know that they're probably not legal and that you should not be going, not only because of COVID, and that alone is the reason why we're out there, but also if there is a fire, for example, or there's another situation, these locations are probably not equipped to protect large groups of people.
Yeah, okay, and we're getting a lot more questions in here. So this is a good question because it's asking sort of about the private property part. Jean Brooks on Facebook: I see many backyard parties in my neighborhood on the weekends. Is there anything that can be done? If you want to start, and I'll chime in there.
Absolutely. So this is where I think if you are calling in to 311, what my team will do is we're going to look for events, and the constant 311 calls trigger for us a visit. So the higher number of complaints via 311, our team will coordinate that with our departments, and then we will provide a proactive call to that household if we have it, or we can potentially go there proactively. If it does not stop, then we will conduct a visit. The buildings department and the fire department, as well as the police department, have authority to actually be in residential homes. My team does not. We enforce businesses, but that's why we travel with our team with this task force. And once they go into a home and there are plenty of people, there are a variety of requirements that as a resident you should be having your home in your home. So those agencies will step into a private residence.
Yeah, and let me put a little more flavor on that we are definitely seeing significant spread. In fact, the most spread among households and exactly these kinds of social gatherings. And if it is a relatively small gathering, you're actually not necessarily afoul of any laws. It's not something, we're not going to come break up, a gathering of 10 people in your backyard. But there is still risk of COVID. And this is where I think understanding that if you are getting together with people, if they're not already in your household, these are folks you want to be doing the things that we know work. Keeping that 6-foot distance, wearing the masks. I know that's hard, especially if it's extended family or friends. You feel safe at home, you feel safe with that group. But the biggest messaging that we're hearing when, I was looking through I look at our sort of cases from the last week, see what's kind of jumping out in terms of reports, and over again, we're just hearing, I was over at a friend's, I got together and went out for drinks or went out for dinner with a group of people. We weren't wearing masks. I felt safe. I wasn't concerned about it. I was at a birthday party with my mom and my niece and my brother and my nephew, and everybody's now got COVID. I got together with a neighbor and we didn't go inside, and we thought maybe we'd be okay, but we talked for about 20 minutes and we didn't have a mask, and in fact, COVID can spread. And I, just want to make the point that this is the major driver that we're seeing right now. And so if you are getting together, you can't be having big raging parties. Like, this is what we will shut down.
That's what we're looking for, right? The big raging parties.
Right. But if you're having even these smaller gatherings, please be responsible. Right. Keep the numbers down, keep the social distancing in place, and try to be as safe as you can be.
Yeah.
All right. Don Wolf on Twitter, what should Chicago restaurant workers do if they know of unreported COVID cases at their restaurant? I have some thoughts on that. I don't know if you have anything.
And we get this question, but the doctor and the health department have put out very specific guidelines in terms of the responsibility of a business. But what I can tell you is that the question I get the most is that if somebody has COVID, is the business required to close? And on that point, I just want to say, and I look forward to having the doctor weigh in on those requirements, but the business owner is required to provide the specific notifications and guidance and ensure that the employees get the time off needed. They are not required to close.
That's right.
They are not, unless the health department deems it so, and that would be an extraordinary situation.
Yeah, and that's because, again, if a restaurant has the appropriate precautions in place, the chance of seeing major spread is actually relatively low. So I'll just remind you quickly that every case of COVID, by law, the health department receives the results. We receive the positive lab result directly from the laboratory or from the doctor, and we call and initiate an investigation into every case, and then do the contact tracing from there. Where we identify potential clusters, right? If we were to identify multiple people who had all been working at one restaurant, or other things, we have different ways of sort of looking statistically at how things are clustering. We will then go and do additional investigations. And certainly, we're actually very used to doing restaurant-related outbreaks because of our foodborne related illness. But a single case of COVID does not require closure. If we're seeing spread or other reasons that we think that the restaurant itself may be a source, that would be a setting where we would work together with the restaurant to think about that. But the great majority of time, people are getting COVID, in their household or at the backyard party or whatever, and then coming to work with it, as opposed to seeing a lot of spread within that work environment. And that's because, again, done a lot to really make these workplaces also as safe as they can be.
Absolutely. And I just want to make one last point on that when there is a 311 complaint on a business, and this is the case. Well, first of all, we investigate all 311 complaints, but when there's a specific scenario like that, our investigators will go in, and what we will observe is to see if the owner of the restaurant or the manager is actually following the guidelines. Are all the employees wearing the face mask? Are they requiring the patrons when they come in that they're seated, and that unless they're eating, is everybody wearing a wear mask? If they're standing and not wearing face masks. And so we actually issue violations based on the fact that when we go in as a response to that 311 call, if the restaurateur is not adhering to those guidelines, they will be issued a violation. So just know that.
Yeah. And then similarly, Brenda Wiener on Facebook is saying, I'm going into restaurants, seeing a lot of workers not properly wearing their masks. What can we do? please report it to 311.
Absolutely.
You can call, or there's an online application. Everything that comes into 311 gets routed. It gets routed to your department, it gets routed to my department, and we use that data. So if you've got concerns, that's the best way in a non-emergent situation to let the city know.
And if I may just say something here, I do think it's important that as residents, we are residents of this wonderful city. I think it is important that if you take that opportunity to actually talk to the manager and let them know that the city has guidelines and that, you know, you certainly don't want to report it, but if they can just do the proper training, or they can follow Dr. Arwoody or I steal a lot of your tweets where the guidance on how to properly wear. I would actually say, without being confrontational, and certainly if you don't feel comfortable, that's okay, but it's good to talk to one another and to tell each other that this is the right thing to do. And in many cases, that will be addressed via that way, but certainly call 311 if needed.
And also, you know, I would ask that if you see a business that doesn't seem to be taking this, you know, seriously, please don't go to that business, right? A lot of this is sort of the social pressure too, that we want the businesses open and thriving that are being serious about this. So,
and we say this all the time. Yesterday I got an important question about, well, what if the patrons that are coming in are not wearing the face mask? And I said, well, then do not allow them entry. Do not service them. If you have the proper posting on the entrance of the restaurant or the bar or even the retail store, and individuals are refusing, then you can refuse service. I think most importantly is to make sure that you're not getting into the, you know, arguing. Just make sure that they have the proper posting, and if you see individuals indoors and managers are not doing what they're supposed to, bring it to their attention. If there is no attention being paid, don't go there, but also call us, because then our investigators will go and likely issue a citation for not adhering to the guidelines.
Yeah, absolutely. We've got a question here, a little bit on the other side. So, someone's pointing out that we've had to roll back some of our reopening guidelines, particularly around bars. Wondering, what are we doing to support some of those bars and other businesses that have been impacted?
Right, and so specifically with the bars, when the rollback was announced, the mayor asked us to come up with a strategy to support those bars. We have roughly about 450 bars that have no outdoor location, and so we had established the expanded outdoor dining, which allows businesses to actually extend out into the street. We devised regulations, and now those bars and restaurants actually have the expanded outdoor dining program that they can utilize as a means to actually operate outdoors. Following the doctor's guidance, any activity that is done outdoors with the proper social distancing and mask wearing where appropriate. And that's what we've been working on. We're very proud to say that we've, as of last week, we had 250 businesses, restaurants, and bars, taverns that actually are participating in the program. And now we're opening it up to these taverns, looking outdoors with the social distancing, and so we're working with the business community as much as possible.
Yeah, and I mean, this is another area where we've been trying to be as quick as we can to sort of change some of these permitting procedures and, you know, try to get some of that red tape out of the way to let businesses be as open as it's safe for them to be.
And I know this is inside baseball, but in many cases, it takes a really long time to implement these strategies because there's laws and whatnot. We literally have done these or established some of these guidelines and new programs in record speed. And so again, trying to really support the businesses, making sure everybody is safe.
Yeah, and so if folks, you know, if you haven't seen this, I would encourage you, you know, you can go online and see some of the details, but there's a lot of new businesses with outdoor dining and, you know, there's been some closure of streets. Like there's a street near me that on the weekends, you know, it's normally a very busy street. On the weekends, you can't drive down it. And instead, there's very well, you know, socially distanced tables and the restaurants, you know, from both sides of the street are sort of sharing that space.
Exactly. And we're allowing the bars and taverns to participate in that. The most important thing is this really careful balance of we want to extend the dining room out, we want to extend the business activity out, but we want no party like environment.
Yes, exactly.
We just want people to go enjoy their meal, enjoy their drinks, and then rotate in and out, let the next group in. Because we also think it's healthy for individuals to come out. And there is no better way for our residents to support your businesses than to actually, you know, support them by getting a meal, walk over, order a meal, take it home, or order a meal, and if you can safely do it at the location, absolutely support the businesses because they really need it at this time.
I've been trying to make a point of buying things locally, just broadly, right? Like really recognizing that I want to support sort of smaller businesses in Chicago. I want to people, businesses that are either near me or just broadly within the city. Even if sometimes it's easier to kind of order something online. Trying to make the point of doing some of that because I think it is a really direct way that we can try to support recovery.
And I try to push the health of walking, like go walk, rather than order. Walk because that also helps the business.
Outdoor walking. I've been a fan from the beginning. I am still a fan. Bring your mask. Go out there. I like seeing people wearing them, and you need to wear them if you're going to be within 6 feet of people. But absolutely, it's good to get out and walk around, and it's a chance to support businesses in a safe way for sure. Okay. I think we've been getting lots of business questions, which I'm not too surprised about. I am going to take maybe just one or two of these science questions real quick. And on Thursday, we'll do a lot of science questions, and I'll do some of the one-offs on the days in between. Angela Brown on Facebook. If I get COVID-19, can I ask for hydroxychloroquine, zinc, and the Z-Pack still? Is that still a treatment? Okay, I've been getting a lot of questions about this, so let's hit it real quickly. Hydroxychloroquine, you might recall, is the drug that initially was developed to help with malaria, and it is an arthritis treatment. It's also known as Plaquenil. A lot of people with rheumatoid arthritis or other autoimmune problems take this. And early on, there were some studies that suggested that hydroxychloroquine might be helpful in terms of treating or possibly even preventing COVID. Those were anecdotal studies, meaning that they were done in sort of a small number of people, and obviously we're interested in any drugs that potentially show any signs that they may be effective against COVID. So there was an emergency use authorization by the FDA, which is pretty common, that if you've got a drug that has had some early studies that suggest it could be helpful, you say under an emergency use, only for hospitalized patients, only with appropriate monitoring, because we know people on this drug can have heart problems and other things. It would be appropriate to potentially try treating these patients. Ideally, you want to enroll them in a clinical trial to answer questions. So what's come out more recently is that when larger trials were done that were the gold standard of trials. So early on, for example, there were trials that said that they're more like case experience. They're like a series of cases as opposed to an actual trial where you sort of, put half the people on a drug and half the people on a placebo, and the doctor doesn't know which half the patient is on, the patient doesn't know which half they're on, and you follow outcomes. That's called a randomized, a double blind, meaning it's blind for the patient and blind for the provider. Those are the best way to actually test whether a drug works. So early on, for example, we had some small case reports that said, I treated 100 patients with COVID with hydroxychloroquine and only 2 of them died. So 98% maybe hydroxychloroquine was effective. But you don't know in that setting whether those other 98 people, would or would not have died otherwise, and you don't know if the 2 people who got hydroxychloroquine would have died otherwise. So you do these big studies, and there have now been a number of very large studies. One was done by the National Institutes of Health, one was done by the WHO, there's a big one that was done out of Oxford that were these gold standard trials, and in all of them, they did not find benefit from hydroxychloroquine. So there are still some ongoing studies, and I just want to be clear that it's possible we could get additional data. If we have a gold standard study that suggests that these work, and I sometimes get hydroxychloroquine plus zinc or this or the Z-Pack and all this together. There are studies going on for those, but as of right now, we don't have evidence that these have been shown to have any significant benefit on hospitalization, ventilation, death. They've not been proven effective when we tried to use them in studies with healthcare workers, for example, to see if it could protect. And so actually in mid-June, the FDA removed that emergency use authorization. So it's no longer kind of authorized for that purpose because the data isn't there. It's been politicized quite a bit, I think, just like the masks have. I think unnecessarily. I like Dr. Fauci's answer on this the other day. He said, I have no horse in this game. When you show me data that's done in this gold standard, randomized, controlled trial way that shows that this works, great, it would be an example of something we'd be happy to use, but we just don't have the data that suggests this. So if you get COVID, if you get hospitalized, your doctors will be talking with you and working with you to help you know what we do have evidence about. Remdesivir, for example, is a medication that's been shown to actually have some benefit. And there are more than, I was just looking this up, there are more than 2,890 studies going on.
Wow.
You can go to clinicaltrials.gov if you want to see all the clinical trials happening for drugs and COVID, and those include ones for these and many others. You can get a sense of who's doing them, what the outcomes look like, whether they're enrolling. That is the kind of data that lets us really answer this question. So it is something that still is under some study, but most of the data that's come out has not really suggested that it's going to be very effective. So good question. All right. Oh, we're still getting some more for you. So let's see here. Lee Clay on Facebook. Do they have city spotters for bars to make sure they are following social distancing guidelines? So maybe I'll start on that point, and then if you want to chime anything. So the city has actually done some work with what we're calling sort of social distancing ambassadors. So for example, this summer, the Chicago Youth Service Corps is about 2,000 people between the ages of 14 and 24. And some of them they're all working on various parts of COVID response, but a good 700 or 800 of them are out in the parks. They're social distancing ambassadors. They're reminding people to keep their distance. They're reminding people to wear their masks. They're sort of doing this positive messaging. We also, this may be the question, we have funded some outreach specifically for that 18 to 29, or in the bars it'd be more the 21 to 29-year-olds, to go out and again sort of be handing out masks, be promoting social distancing, really sharing good information in parts all over the city, folks with different backgrounds and different focuses. So in that response, yes, we have been investing some resources in that. I don't know if you have anything else to add.
Yeah, no, we actually 911, 311 calls. We monitor the calls. We do have weekend and night and weekend investigators that are out during the weekend. We do frequent the commercial corridors, especially if we get any reports that there's large groups in congregation. And our goal is, again, working very closely with the businesses. We also work very closely with chambers of commerce, about 100 of them across the city, who are also our eyes and ears, but they're actually advocates, and they're helping us just, again, continue to promote the message of staying safe.
All right, great. So we're coming up on time. This went very fast today. Always, thanks for everybody's good questions on this. This is, again, this is a piece of COVID response that people don't always think of, but I love highlighting the different parts that have just been absolutely crucial to our city's strong response on COVID. So thank you again for the work of your whole department and for coming on today. Anything else that you want to really either raise that you haven't had a chance to, or sometimes we end with some good news or things to do?
Sure. I guess I would just say I want to thank the entire Chicago business community. They have really been hit hard by this pandemic. Their business is their livelihood. And so thank you to the business community. Thank you for working with us. We know that we're out there. We want to continue to work with you. And to the residents, please support your local businesses. They really need you now more than ever. We're definitely there also to address the issues and the complaints and the concerns that you may have. Please let us know through 311. Certainly follow Dr. Arwoody on Twitter, on social media, and or follow us. We put a lot of information out there for the business community and for our residents. So thank you for all you're doing.
Yeah, perfect. Thanks so much. I'll add just a couple of specific things. So the Together Now Fund, which is one of the many grant and loan programs, is doing a second round, another $6.2 million for grant allocations. It's in partnership with the the Chicago Community Trust and One Chicago Fund. It's about providing assistance to small businesses and not-for-profits that have had economic distress or significant operational losses from COVID. So the second round is coming live, and if you want to get some more information about that, you can go to chicago.gov/togethernow. Or you can always get there off the COVID page.
Absolutely.
And then the other thing I'll just add is that we talked a little bit about this outdoor dining program, and certainly there's been such a lot of work to get this expanded and just generally things for bars and restaurants. So I know you've been hosting webinars recently for businesses, and that's been ongoing. And I believe there's a couple this week as well.
Yes, there's one tomorrow and Thursday. So for the restaurants and or bars that you're interested in that program, please go to our website at cityofchicago.gov/BACP, or also you can actually access us through the COVID website as well.
Exactly. It's chicago.gov/business workshops to get you there directly. So we try to have multiple ways for folks to get there. But if you yourself are part of a business, or folks are, and you feel like they still have questions or concerns, we've put a lot of information together, and your team has really been out there, week after week after week, trying to be all together as much as we can for businesses, trying to help us weather this sort of on the economic side while we continue to work on the health side. So I think with that, I will also just end by wishing Mayor Lightfoot a happy birthday. It's her birthday today. So not a birthday she expected, I am sure, just in terms of everything that's going on. But I think with that, we will be back on Thursday at 11 a.m. I'll be back with Sybil for just our standard, more science-based questions. And in the meantime, keep putting in questions. We're doing daily, just shorter updates on questions. So we do see what you put in, and we're making an effort to get as many of those answered as we can. In the meantime, please do the things that we know work. We need to turn these numbers around in Chicago so we can be doing more reopening and being able to bring these businesses back even more, instead of having to think about having to pull stuff back. It's not where we want to be. You know what works. Keep doing it. We'll see you Thursday, and be safe, Chicago.